AI is entering hospitals and clinics in a way we have never seen before. It is diagnosing diseases, predicting illness, and saving doctors time. What used to take hours in labs can now be done by AI in under a minute. From X-rays to blood tests, AI reads data faster and more accurately. Hospitals are using machine learning to detect cancer in its earliest stages. Chatbots and virtual nurses are guiding patients through routine care. AI is predicting patient readmission and preventing emergency relapses. Doctors are getting second opinions from AI trained on millions of cases. This technology is not replacing care, but enhancing it across every level. With AI, rural clinics can get access to specialist-level insight instantly. Language barriers are reduced with AI that translates in real time during care. Even surgeries are seeing AI help with precision mapping and robot assistance. AI is taking the load off overworked staff and improving patient outcomes. We are witnessing a shift in how healthcare operates on a global scale. Let us dive into the AI tools that could change healthcare forever. Early detection through AI diagnosis. AI is now capable of identifying disease patterns invisible to the human eye. It scans mammograms, MRIs, and CT scans with unmatched speed and accuracy. AI has shown to catch early-stage cancers that doctors often miss in screening. It detects diabetic eye disease, lung conditions, and heart risk in seconds. Training data comes from millions of patient images and medical records. AI models continue to learn as more data is fed into their processing system. This leads to more accurate diagnoses and less time spent waiting on labs. In rural or low-resource areas, AI helps bridge the doctor shortage gap. It does not replace radiologists, but gives them a highly reliable second read. AI is now identifying genetic risk markers long before symptoms appear. Real-time alerts notify providers when early warning signs are detected. This allows doctors to act earlier and prevent disease progression entirely. AI tools also help identify errors or missed items in traditional workflows. Hospitals using AI report fewer misdiagnoses and faster patient turnarounds. Early detection means longer life expectancy and better quality of care. AI in virtual health and patient monitoring. Smart sensors and wearables track vital signs like blood pressure and oxygen. AI analyzes this data to detect abnormalities before they become emergencies. Patients with chronic illness are monitored around the clock using AI alerts. If a condition spikes, both the patient and doctor are notified immediately. This reduces hospital visits and keeps high-risk patients under active watch. Virtual nurses check symptoms and suggest next steps using AI conversation. Chatbots walk patients through intake questions or follow-up care instructions. AI also assists with medication reminders and daily health habit tracking. This level of monitoring is especially helpful for elderly or disabled patients. Home care becomes safer and more effective with real-time AI support. Insurance companies use AI to flag risky conditions early and suggest solutions. Predictive models warn of potential readmissions or post-op complications. Emergency rooms can triage more accurately by using AI input on symptoms. These tools offer faster service while reducing pressure on nursing staff. The result is a smarter, more personalized health system in real time. Surgical precision and robotic assistance. AI is guiding surgeons in real time with 3D mapping and predictive modeling. Systems analyze imaging data to highlight critical nerves and blood vessels. Robot-assisted surgeries use AI to ensure precise movements and measurements. AI can simulate a surgical path and suggest less invasive options beforehand. During operations, it tracks vitals and alerts the team to early warning signs. Machine learning predicts how a body will respond to various surgical tools. Post-op recovery can be optimized using AI feedback and patient data analysis. Complex surgeries become safer with a combination of human skill and AI logic. Doctors rely on AI to reduce risks and improve surgical outcomes long-term. Robot-assisted knee and heart surgeries are already happening in major centers. AI helps reduce surgeon fatigue by automating repetitive tasks and monitoring. Every step is measured and refined, creating a data-rich surgical record. AI tools also reduce surgical time, lowering patient exposure to anesthesia. Hospitals using AI in surgery report faster recovery times and fewer errors. This is not science fiction. It is the new standard in modern operating rooms. Administrative and operational efficiency. AI is cutting hours of paperwork by automating medical documentation instantly. Voice recognition tools now transcribe notes during patient visits accurately. Billing, coding, and claims are handled faster with fewer human errors involved. AI schedules appointments based on doctor availability and patient history. Hospitals use AI to predict supply needs and reduce medical waste significantly. It helps streamline staff shifts and workload distribution across departments. Chatbots reduce wait times by answering common questions and pre-check-in steps. AI-driven triage systems prioritize care based on urgency and medical profile. Medical records are analyzed for trends and compliance automatically each day. With less admin work, doctors can spend more time with their actual patients. Hospital performance reports are generated without manual data entry effort. AI detects billing fraud and flags inconsistencies in insurance documents. This reduces operational costs and improves transparency for all parties. Smaller clinics use AI to stay organized without hiring large admin teams. Efficiency in operations means better focus on patient care and staff morale. Personalized treatment and medicine. AI helps doctors move from one-size-fits-all to fully customized treatments. Genetic data is analyzed to predict how a person will respond to medication. Cancer patients get therapy plans tailored to their unique genetic profile. AI recommends drugs based on thousands of similar cases with known outcomes. It adjusts doses in real time based on biometric feedback and side effects. This minimizes trial and error in finding what works best for each individual. Data from wearable devices feeds back into refining ongoing care continuously. AI can suggest dietary, fitness, or lifestyle changes based on personal health. Patients feel seen and heard with care that adapts to them at every level. This approach improves adherence and results by matching care to real needs. Doctors gain a digital assistant that recommends options they might overlook. Machine learning identifies which patients are likely to benefit from new trials. AI empowers proactive prevention instead of reactive treatment models. With personalized AI care, recovery becomes faster and less stressful. Healthcare becomes not only smarter but deeply human-focused in delivery. Ethical questions and future challenges. AI in healthcare raises serious questions about data, privacy, and control. Patient records must be protected to avoid misuse or unauthorized sharing. Bias in AI models can lead to unequal care unless training data is diverse. Doctors must remain involved in every step to avoid over-reliance on machines. AI should assist decisions, not replace human empathy or judgment in care. Legal responsibility in AI-driven errors remains a complex issue today. Trust in AI tools depends on transparency and fairness in their design. Hospitals must train staff not just to use AI, but to understand its limits. Clear guidelines are needed to regulate AI safely across countries and clinics. Patients must know when AI is being used and have the right to opt out. Failing to address these issues could erode trust and slow progress overall. Tech companies must prioritize ethics as much as innovation in this space. AI offers great power, but it must be held to the highest standards. If done right, AI will amplify care rather than compromise it. The future of healthcare depends on how wisely we develop and use this tech. AI is changing healthcare from the inside out, faster, safer, and smarter. It helps doctors diagnose, operate, and monitor with never-before-seen accuracy. Patients get more attention, better outcomes, and personalized treatment plans. Hospitals reduce costs and save lives using machine learning and real-time tools. But this tech must be guided by ethics, human oversight, and patient trust. Used right, AI can expand care to billions while improving quality across the board. Thanks for watching. If this inspired you, leave a like and drop your thoughts below. What role do you think AI should play in the future of medicine? Let us know. Subscribe for more insights into the technology shaping tomorrow's world today. We will see you in the next one. Stay informed, stay healthy, and stay curious.